Hello class! Welcome to Module 2, titled EBP Paradigm and Process in the NU708 course. Module 2 examines the EBP paradigm shift of reviewing, appraising, and moving quickly to translating current available best evidence into practice. The EBP process dictates that you, as a clinician and leader, develop in yourself and demonstrate a spirit of inquiry. That spirit is the foundation for EBP and for generating PICO questions. That spirit of inquiry is a desirable and required attribute for a nurse with the DNP degree and for your foundation in advanced nursing practice. The student learning outcomes for Module 2 are the following. At the conclusion of this module, the student will be able to, number 1, describe the elements of the EBP process. 2, describe a clinical scenario with a clinical question for study. That you will bring from your own practice. 3, write PICO question for that scenario and other PICO questions. Number 4, identify parts of PICO questions and keywords for searching. To help you examine the EBP paradigm and learn to use the EBP process, I have included a lesson for this content in a Word document for your study and reflection, along with an EBP exemplar. In it, you will view the history of EBP, its definition, how to compose a PICO question, and to correctly identify the parts of the PICO question. This is very, very important. This is the process. Templates for constructing PICO questions to correlate with clinical problems are included in the learning lesson for you. Here are 7 steps of the EBP process. Number 1, cultivate a spirit of inquiry. 2, ask the question. Then search for the evidence. Then appraise the evidence and synthesize best evidence. Next, integrate the best evidence with one's clinical expertise and patient preferences and values in making a practice decision or change. Then evaluate the outcomes of the practice decision or change based on the evidence that you found and implemented. And finally, disseminate the outcomes of the EBP decision or change based on evidence. You will find these listed in your course as well. In this course, we will focus on steps 1 through 5 of the EBP process. This will enable you to strengthen your study in the foundations of evidence-based practice. During your future leadership courses and in your DNP projects, you will learn more regarding the theories surrounding leading innovation and implementing evidence-based clinical practice guidelines in organizations and facilities. But first, let's learn the basics of the process in this course. Now, let's reflect a moment on knowledge again and consider the theory-practice gap that nurses have often questioned. At JSU, we adopted the Melnick and Fineout-Overholt EBP model. Refer to Module 2 and to your Melnick and Overholt text. This EBP model diagrams a framework for practice which includes the following: taking research evidence and evidence-based theories, incorporating clinical expertise with those theories, which is composed of data from patient assessment and use of healthcare resources, and adding to it patient preferences for treatment decisions. These 3 parts then form the basis of clinical decision-making within a context of caring and guide patient, caregivers, and providers and facilities to achieving quality patient outcomes. So there are 3 parts of this model. The research evidence and evidence-based theories, blending those with your clinical expertise, which is composed of the data from your patient assessments, and also with using the resources available at the healthcare organization where you work. And finally, presenting those to the patient and their families, and blending those with the patient preferences of choice for their treatment. That's the EBP model. This is what EBP is all about: determining what is best practice based on documented, appraised evidence from the literature, along with clinical, expert opinion, and available services. It is not based on one study that is found in the literature, read and reviewed, and shared with nursing staff or students. Can you begin now to see the difference in research utilization of a single research study and true evidence-based practice, which impacts patient care and ultimately improves patient outcomes? Think about that as you work through this module. The aim of this module and of this course is to guide you to understand the EBP paradigm and the EBP process, and how to function in practice as an EBP nurse, mentor, leader, administrator, consultant, or educator, wherever you work and in whatever setting you practice. DNP's Advance EBP.